So this is just going to be a very brief overview on some of our imaging technology that we have for our Elekta machines. We use XVI for our KV imager, and to do that, these are the main controls that you will use. So this is to move the panel outward, and this is to move the panel inward. For our MV imaging, we use iView, so this is the remote that you will use, and you will kind of use the same functions on this one. This is to move the panel outward, and this will be to move it inward. So whenever we take a KV cone beam for one of our patients, the first thing that you will have to do is pull out our imager from the wall, and then you will have to hold down the enable buttons and draw out the imager that way. And then once it's in place, then you can use the yellow button to retract it back inward. And once you are finished with your imaging, then you have to press the blue button and manually push in the imager as well.
Will this be a brief introduction to the imaging console for our Elekta machines? So this first purple button down here is just the enable button, so you'll have to hold it when moving any of the equipment inside of the room. So for example, if you wanted to move the gantry or collimator, you'd have to hold the enable button and press this button right here, which moves the gantry and collimator. And then this middle button moves the table from inside of the room, or from outside of the room moves the table inside of the room. So you'd have to hold the enable button and move. And then this button right here just brings the MV panel in. It can't retract it out, but it can bring it back in. So like we talked about in the room for our cone beams, this is the button that would allow us to turn the beam on and start the cone beam. The yellow button would pause it. The green button would start our treatment beams, and the yellow beam would pause it. And then the red button, in case of an emergency, would just terminate the beam, and then you would have to go into the room. So after taking the cone beam, we'll see this screen and we'll have to accept the cone beam. And then we'll first start by pressing automatic registration. And then you hit convert to correction. So yeah, we're just gonna show you a couple tools for this imaging. So the first things first, the image that you see is the cone beam that we just took today, which we then compare to the plan. So if you kind of just go back and forth between the two, you can compare them and see how they look different. Some of the tools we can use when looking at the images is just this purple versus green tool. It just helps us show the difference between the cone beam we just took and the plan. Another tool is checkerboard, which you can kind of see allows you to go back and forth in between the plan and the cone beam we just took, which is helpful when looking at bony anatomy because it can help you see in the three directions where you're off and what shifts need to be made. And then also this magnifying glass with the plus is just zooming in, which can help you see a smaller area where we're treating, and then zoom out. And then also this half moon sun button allows you to change the filter of the image when we're looking at it, which is sometimes helpful depending on what site we're treating. Like if we were treating a lung, we might click the lung filter, making it easier to see. And then also under the reference tab, if you click structures, it allows you to see all the different contours. And if you click on them, you'll just be able to see where they are, which makes it easier to see. And also it allows you to see the PTV and the GTV, which is helpful when you want to focus your contours and align specifically to the PTV. So that's also really helpful because sometimes there's a lot of contours on the screen and you don't exactly know what to focus on.
When you're ready to make shifts on the image, you have to hit that little crosshair button, and then you are able to see this down here and see the shifts that it applied from the plan position to where you currently are right now. If you move it in the X direction, the up arrow will bump your contours to the right. The down arrow will bump your contours to the left. If you look at the Y plane, that's going to move your contours up and down. So up arrow will move them up, the down arrow will move them down. And then for our Z plane, that is actually anterior to posterior. So if you use the up arrow, you can see it in this direction. It is shifting the contours anterior. And if you use the down arrow, that is going to shift your contours posterior on your patient.